Greetings all, my name is Carlos Rodriguez, and in this video I'm going to be talking about my shadowing experience. So, throughout the month of August, from the dates of August 12 and 13 through August 19 and 20th, I interned with this hand surgeon named Dr. Douglas Wallace. So Dr. Douglas Wallace is a orthopedic hand surgeon at Rady Children's Hospital in San Diego, California. Yeah, I got the got his contact info. I got this arrangement with my dad, since he works there as a medical assistant. Um, he cleared me. Like, he said that I can intern with him for those dates, and you know during my time interning with Dr. Wallace, I learned a lot about the formalities of the hand, meaning like there's like fractures of like the carpal, metacarpal, and the phalanges bones, and also there can also be discrepancies from the forearm bones, meaning the brachius and the ulna. I also learned that being a hand surgeon, especially in the pediatrics, like a pediatric hand surgeon, can be quite difficult at times, because you have to deal with kids. You have to deal with kids, complaining about their pain, crying, wandering around. But that's really not the case. I mean, some kids, like the vast majority of kids that I saw while I was shadowing with Dr. Wallace, they behave relatively well, because they know that the doctor is not there to hurt them. They're just there to help them get better, and help them with their hand functions, their hand movements, and all that type of stuff. And the other doctor that I shadowed with is a sports med surgeon named Dr. Andrew T. Pennock. He also works at Rady Children's Hospital. I shadowed with him from the dates of August 14th and 16th through the dates of August 21st and 23rd. So yeah, so like I said earlier, Dr. Pennock is a sports med surgeon. The vast majority of his patients are of adolescent age, meaning like they're teenagers. And like the some of the most common cases that I've seen Dr. Pennock you know take care of are like knee injuries, meaning like the meniscal tears, or the torn ACLs, or like ACL is the abbreviation for anterior cruciate ligament, which inhibits the humerus from, or not the humerus, the femur from moving sideways. It just keeps the leg stable. So one of the most common operations that Dr. Pennock does are knee arthroscopy, meaning that he'll put like a mini, like a microscopic device using a smaller incision, and putting that thing inside the incision to verify any discrepancies in not only in the cruciate ligaments, but also in the meniscus. But a couple of stuff that he also does is autografts, which are just like taking parts of your tendons to create a graft that replaces the torn ligament, or an allograft, which replaces which is a graft that is brought by a donor. So what I learned from my experience as a whole, from those two doctors, is that a physician, or perhaps any professional, has to be very competent and very knowledgeable about the treatments that they give to the patients and also the parents. And the physician is also liable for the um, for the patient's suggestions, the patient's decisions, and the physicians act like counselors for the patients. So that kind of motivates me to to help out, to reach out to people, and potentially encourage them to change his or her life for the better. And this concludes my reflection on my shadowing experience.